you today?
Well, thank you. All right.
Thanks. Right. So you do know today we're going to put the energy settings up higher, obviously, to get the results. And you have put your anaesthetic cream on a few hours ago.
Yes, I have, yes.
Right, great. That seems to help, doesn't it?
Yeah, and also if you find that if you take a paracetamol, that can help with the pain as well.
Right, okay. What would you describe the pain to be like?
I'd say it's on par with actually physically having the tattoo itself. I'd say it's about the same sort of pain. And a lot of people describe it as an elastic band flicking against the surface.
Right.
But it is certainly bearable for the end result that we'll achieve.
Right. So just for the purposes of this video, Rachel, I'll just point out a few things to people. For this size tattoo, for the colour, it's very treatable. The laser picks up on colour, so dark colours are best to be treated there. And you've had 3 treatments so far, and it is a permanent tattoo. It's a professional one as well. So obviously permanent tattoos take time to go. So we've talked about between 8 and 12 treatments are probably what we're looking for, but obviously you need to judge and we'll see together how we're getting on here. And the intervals need to be 6 weeks minimum between each one. Okay, what I'm going to do first is just cool it down a little bit, give it a little bit of a cleanse. Are you comfortable there?
Yeah, thank you.
Look and see. Okay. That's great. How does that feel?
Bearable.
Sure.
Yeah.
All right with that. Okay. If I go a little bit faster, is that all right for you?
Yeah, that's no problem.
So let me know anytime you want me to pause. Okay. I'll do that loud clicking, and what that is doing is breaking up the colour to allow your lymph system then to break it up further and get rid of it. That's what we want. Done a little bit. Are you alright?
Yeah, no problem.
And that cream really helps.
Yeah, it does certainly make it hurt a little less.
You're getting brave as
You have to, do you?
No pain, no gain.
Exactly.
Just make sure you've got everything. That's it. And obviously what we can get here, I'll just take my glasses off, is a little bit of reddening around the area, which is what you can see here. And you can feel it slightly raised, which we know. And also, as you know, that you can get a little bit of blistering and some pinpoint bleeding, which doesn't mean anything's gone wrong. That's quite normal. It's something you just have to obviously not burst any blister. Just make sure it stays intact so that it will just go down and heal and not introduce infection. Just got some, this is in the fridge, so it's nice and cold. Aloe vera gel. And as you know, there's also a coolant in one sheet, so that cools it down even more because your skin can heat up quite a bit, can't it?
Yes.
How's that?
Alright, yeah, that's nice.
A couple of minutes to really sink in. That's great. So how are you feeling? Just had your treatment now.
Yeah.
How are you feeling?
Yeah, feeling good, feeling confident that it is diminishing. I mean, you can see there that it really is starting to fade down. So this is the 4th treatment, so hopefully, another few more and you should really see a dramatic difference.
I mean, I think that's what I have to point out this in the initial consultation when I speak to people. A professional tattoo is supposed to be permanent.
Yes.
So obviously a treatment course is necessary, and I have people sometimes saying to me, I've had one treatment, I can't see any different. You won't see a difference straight away because it's a very subtle, gradual phase of it. And people when they get a tattoo, they don't quite realise that, there it is there, I've paid my money, if I want to get rid of it, it's the same, and it's absolutely not. So you could be with me for a length of time, months is what we're looking at. And obviously every time you come, I'm going to be saying to you, how do you think it's going, so that I can, adjust my settings, because some people, it goes quicker because of where they've had the tattoo done. The ink, what type of ink, if you've had it abroad, if you've had it done in the UK, and also if some people have had tattoos for 30 odd years, sometimes it can come off quicker, sometimes it can be really stubborn, and I have to point that out because I know it's disappointing for people, and I try my best to explain that initially, but people are just focused on, I want it gone, which I understand, so we're getting there anyway.
Definitely,
definitely.
Great.
So we're thinking probably between 8 and 12 treatments, but until you're satisfied that it's gone as much as it can do. So as we've talked about how many treatments, Rachel, are needed, obviously this is all through my machine. It's not a treatment I've done, but it is from this machine. This is before. This is to illustrate that green is quite difficult to get rid of. It can be quite stubborn. It's not to say it can't be removed, but just not with my Q-switch laser. And you can see it's slightly there, but the rest of it's good clearance. We've got here an amateur tattoo, which can take a little bit less time because it doesn't go as deep into the dermis. This is more on the epidermal layer there of the skin. And we've got another one here. Again, lots of it, it's breaking up sort of not in a uniformed fashion, it's breaking up in little bits, but again, this is just to illustrate that the green is difficult. And we've got here a tattoo that's practically gone. We're just illustrating that when this lady depresses her skin, you can see it very, very slightly, but I don't know about you, I'd be happy with that.
Absolutely,
that was me, and that's after just 5 treatments. So it can be very effective, but patience is obviously needed.
Yes.